Ik heet Ferdinand Lewis. I'm Director of Science and Education for Arts and Health Netherlands. We're part of the Aletta Jacob School of Public Health. Today we're going to talk about arts and health. Welcome. Mijn Nederlands is niet heel goed. Ik moet in Engels spreken. Patience with me on that. I'm going to start off by talking a little about what arts and health is, and then what also it isn't. It's a very particular practice, arts and health, and it means something very specific here. I'll also talk to you about where it happens. Then we're going to make some art together here today in the next 35 minutes. And then I'll talk about why this is important and connect this to the research and the work going on in healthcare and innovative healthcare in the Netherlands. When we talk about arts and health, we talk about it in terms of activating the imagination in a way that is not passive, but that is actively engaged in a way, right? So actively being creative. The engagement is an important part of it, and we'll talk more about that. Come on in. And we'll talk more about that in a minute. Arts and health is, yes, if you're a patient in long-term care, knutselclubs, and people always laugh when I say that word. Knitting and movies. These are entertainment. They're passive entertainment, and there's absolutely nothing wrong with that. That's a good thing. Arts and health goes a little beyond that, right? And again, we'll talk about that and even show you what we mean by that today. So it's not only entertainment or passing the time, but that can be part of it. Most importantly, arts and health is about supporting well-being. Arts and health is, we're not art therapists. I have worked with a lot of art therapists, but in arts and health, we're not actually delivering treatment. We work with people who do deliver arts treatments, but that's not what we do. We do a more broad support for well-being. There's some chairs if you want to join us. So we're always careful to say that we're not art therapy. We don't write in the patient's chart. We don't diagnose, and we don't deliver particular outcomes. However, 30 years of research from around the world shows that the arts have powerful effects on people's health. We just know that is the case, right? But in this field, we don't go in to deliver those outcomes. We support well-being. Where do we do this work? There's basically three places where we work. In critical care and acute care in hospitals. So when I did this work for 4 years at the University of Florida before I moved to the Netherlands, and I worked at the bedside. I was in literary arts, and so I did creative writing and reading and storytelling with people who were in a bed with tubes coming out of them. And here you see some colleagues of mine actively engaging people who are in acute care. Long-term care arts and health is very popular, and you have in the Netherlands, you have what's called a participation choir for people with dementia who are singing or making music alongside people who don't have dementia. Also, there's a dance company similar to that. All in nursing homes, but also in community centers. you'll find arts and health practice. In communities, arts and health supports prevention, essentially, illness prevention. So when we're working in a hospital or working in long-term care, we're supporting well-being of people who are in care. When we're working in communities, at the community center, let's say, or working with I don't know if you can see this picture of the graffiti grannies in Lisbon. These women are absolutely out of control in Lisbon. They now tag at will, but I love them and many people do as well. They're tagging all over Lisbon. That is about keeping people out of care, keeping people out of the hospital, out of long-term care, helping people stay at home, work, and be well. I want to introduce you to some colleagues of mine, and we're going to do some work with you, some arts and health work. And I'll talk some more afterwards about the research and why we do this stuff and where we do it a little more. And then we can talk, if you have questions or comments, we would love to talk with you. Before we go any further, allow me to introduce two musicians from MIMIC, which is an organization that does arts and health in music. Arts and health, I have seen this work done in any art form. In any art form you can imagine. I've seen rap, right? I mean, I've seen it applied anywhere. With any art form. Music is at this moment a popular topic in arts and health research in the Netherlands, and especially in Groningen. And so we were lucky to get colleagues from an organization called MIMIC that does this work around the Netherlands. If I can introduce Kaya and Krista. Would you come up and join us? And you can put these wherever you want and move them wherever you like. So imagine that you have just checked into the hospital for a procedure. Many of us know exactly what this looks like, you know, and some know what it feels like, right? My clothes are taken from me. My watch is taken from me. My family is taken from me. My home is taken from me. My identity, to some degree, becomes my illness. Oh, he's the liver transplant in room 211, right, rather than who I am, right? I don't control, there's no lock on my hospital room door. I don't control the lights necessarily. I mean, I have some control of the lights, but somebody can turn them on if they need to. People can come in and out, so I don't have privacy, right? Imagine coming into a room, and I'm being wheeled into the room, and there's music playing. Let's say someone has put a concert on the television, so I'm hearing music, ambient music. That's fine. That's perfectly fine. Then later in my time there, somebody knocks on the door. I says, hi, my name is Ferdinand Lewis, my name is Kaya, my name is Krista. We're making music today for patients, and we're wondering if you would like to hear some music. It really is that simple. Here's the important part. You always get to say no. Yes, you see the nods. You can't, as a patient, you can't say no to the doctor, to the nurse, to the order, to anybody. You can say no to a geestelijk verzorger, but nobody else. But you can say no to us. And that is in itself a kind of tiny bit of empowerment. But if you say yes, we could just give you some headphones and invite you to play whatever music you like, and that's good. You're sort of curating your own music. But there's something else about presence that we deliver in arts and health. And I'm going to ask these guys to do a little of that. Would you like to hear some music today?
Sure.
Ah, wonderful. Great.
Now, we
And just talk, and I'll catch up with you.
We'd be happy to play for you a piece that we're also hoping to bring a little bit of calmness and perhaps a little bit of feeling of nostalgia to this moment. Resonated maybe with some of you. I heard a little bit of sing-along, and I believe that maybe this was a piece that many of you knew, and maybe connect some memories too, also.
Yeah. Is this the sort of thing you would play in the hospital?
This would be one of the pieces, so we tend to really try to have kind of a rich backpack of repertoire, because everybody has a different kind of a relationship to music. Everybody has different songs that have meaning to them. I mean, that's meaningful music in healthcare. It has to have personal meaning. So it's not a concert where we have a kind of a preset list that we come and play that we think is nice. Our repertoire often grows by encounters with patients. That somebody's talking about John Denver's Annie's song. Well, that's a beautiful piece. We'll practice it, and maybe we can make somebody else happy with it as well.
Nice.
So
nice.
Yeah.
So you would be asking them, well, what about this? Or like that, you maybe give them a list of things, right? And then there's this power of it being yours. You're there in the room. Maybe there's other people in the room. Maybe it's your family. Maybe it's other patients. Or maybe it's just you. But this is yours, right? Let's see if we can go a little further, right? If we can take this a little further. So then the question becomes, how can we? You are, in a sense, passive. You're activated because they asked you if you wanted this, and you said, sure. And you're engaged, and you could very easily have a little conversation. This is about how close it is. You're in a hospital room. It's actually closer than this. You're like right up on it, and you can feel the vibrations. If we go a little further, we might, if perhaps, would you like to participate? Would you like to hear some music? Yeah?
Yes.
Okay.
What we would really like to do with you, if that's all right, I'd like to ask for, because let's say that you would be in a place where you're kind of not in connection with places that you love, or the world outside, and we'd like to just ask you for a landscape, for example, that you'd like to now be in. It's raining, it's kind of dull. Perhaps there's another place that would give you a really good feeling. Maybe it was a holiday destination, or maybe it's something else.
Okay, well, let's say the beach.
The beach.
Do you need a specific place?
Yeah, please.
Let's say the beach in Italy.
Nice.
Yeah. Sardinia.
Oh,
Yeah.
there. Can you describe a little bit? How does it look?
Well, the sand is white, the water's blue, the sun is shining, bright blue sky, cocktail bar right behind me, and a beach volleyball court,
Yeah.
potentially.
And mountains?
Yeah,
Yeah,
that
some
would be
mountains.
nice in the back.
Okay.
Yeah.
Okay. Well, I think we can try to create the feeling of the beach. And it sounded like a very nice place to be. Very positive.
Yeah.
And then maybe indeed in the background we see some mountains too.
Yeah. So we will try now to make this into music. We will, yeah, make it here.
I have seen this. I've seen this done with dance as well as music. Very, very popular. Conducting, you know. Imagine you've checked into the hospital, and as nice as they treat you, you're still not home. You're still not with your people. You're not in your place. You don't have your safe stuff. But this moment is yours.
Yes.
This is absolutely, as much as we can, it's your moment. And it's a when you step into and you say, yeah, I'm going to do this. All right.
Yeah.
You said it.
Takes a little courage.
It does.
To take the lead. Yeah.
There's science about this. People study this stuff. And it's at that moment that it begins. If there is something wholesome and well in you, you've identified with it right there. The part of you that isn't sick. Yeah, I can do this. And again, I've seen people do this. A person who couldn't move conducted with a straw in her mouth once. I mean, this can be done. I've seen it in the burn unit. I mean, extraordinary circumstances. But if somebody wants to make that choice, they will. It's just about facilitating it. I'm going to show a couple more slides. Let's give a hand for these guys.
Yeah.
I love my job. If you I walk into my room and they put a concert on the TV and I'm listening to some music, and that's fine. That's not a problem. That's ambient, we would call that, right? I'm just sort of hearing it. I'm not really involved in it, right? If I'm making choices, right? If we go to the museum and I'm walking past things, you know, but then suddenly I stop and look at something, I'm observing it, I'm receiving it. I'm not really engaged with it yet, but I see it, I'm there, and that's a good thing. All of these are good. Then at the point where I'm asked, what do you want? What do you want to hear? What do you want to see? What is it about this that you like? What is it that interests? I'm now operating more with discrimination, the way a curator would. I'm actually stepping a little bit into it. Then, when this is about how you felt, a favorite place, for example, the beach in Italy, the cocktails, that was perfect, right? Especially the challenge of that. You could see they were actually struggling with the cocktail part. That's about, I mean, that's you interpreting, bringing an interpretation to this music. You're in it at that point. You're in it, you know? And then finally, you're creating something, right? In collaboration with the musicians. That's just not an exaggeration. You actually are. I mean, this is making stuff, right? And the science shows that can have quite wholesome, beneficial effects. Again, we're not therapists. We don't do therapy. But we know from the science that this is good. That's how we get into places like hospitals and long-term care facilities, because the science shows this stuff is good for you. So, what does arts in health do? We talk about it this way. The care experience, which is famously drifted from Florence Nightingale to the industry that it is now, all of us who work in healthcare want it to be more of a human experience for patients, and that's part of what arts and health does. Arts and health is quite specific in what it does, but nothing else does what arts and health does. Empowering people in pursuit of their own well-being in a tiny way, it's a very specific thing, but that moment where you go, yeah, I'm going to do this, that's the same moment that you make. There's so many opportunities in our lives to make that. I'm going to do this. The same thing, right? It's a kind of empowerment to pursue your own well-being. And that, as healthcare changes, we know it has to change in the future. We don't know how it's going to, nobody knows how it's going to change. We have ideas, but nobody's sure. We know it's going to change, but we do know. Science tells us, researchers predict that there'll be a shift, and engagement of value-based healthcare, positive health, whole person health, somewhere in those models, we're going to find the future. Arts and health has a contribution to make in there. And we are trying to make that. We started this organization in Groningen at the Aletta Jacobs School of Public Health. It's called Arts and Health Netherlands. We have 3 goals that we pursue. The first is very simple, to put as many practitioners of art, for example, with people who need it as possible. That's our #1 goal, is to get as many artists as possible trained, active, and into the community working as much as possible, so that in 8 or 10 years, it's an actual profession in the Netherlands. It is not now, but it ought to be. Lots of people want it, lots of people. Education programs that train professionals, mid-career professionals who want to take this on as part of their skill set, or people in college who want to pursue this as part of higher education. Then there are research projects around the Netherlands. Both our musicians today, Kaya and Krista, are both involved in research projects. I'm involved in research projects. Lots of people here today are. We don't do research at Arts and Health Netherlands, but we support it. We want to connect people. We want to connect researchers to projects that are staffed by artists who know what they're doing, who know how to say, great, share your research design with us. We'll figure out a way to plug the artists in there and the pay. We need programs and people who are educated and know how to make this work in a stable, sustainable way. And that's what we try to do at Arts and Health Netherlands. We're supported by the Aletta Jacob School, as I said, also National Programma Groningen, and the University of Groningen as well. We work around the country, but we're hoping to bring as much focus as possible to the north around the topic of arts and health. We want this to be the center of arts and health, the north. I would like to thank all of you and our musicians, but I also want to open it up if you have questions and comments. Let's do that now. Yes? Please.
What kind of...
I'll hold it.
Yes, okay, thank you. Sorry.
That's okay.
What kind of additional educational topics are they receiving? Are the artists receiving?
Do you work in medicine now?
No, in the preventive.
Preventive. So to work in a hospital, for example, you have to know how to not interrupt the medical care that's going on. That doesn't mean you have to become a nurse, but you have to know how to stay the heck out of the way. And if machines go off, you have to know what to do. Not to give treatment, but if you need to get help, when to get help. Or if the patient says, you know what, I hate my doctors, what do you do with that information? So there's ethical protocols. So that's part of the training, as well as this wonderful kind of lowering the threshold that you saw these guys doing, just making it so easy. We're not intimidating. They're not wearing formal wear. This is, you know what I mean? Come on, play with us. That. So both of those, yeah. There are lots of people who are artists who want to do this, but also lots of people in healthcare and other fields who just want to do this work. Yes, please.
I think this is more of an observation. What I love about what you're doing is that you're lowering the threshold, and it's also reconnecting with a really deep need of people to make music. And what you see now is either your publiek, audience, thanks, or you're consuming it. You're watching, or the audience, or you're the audience, or you studied. You're breaking down those barriers and making it very human, and I love that.
And it has powerful effect.
Yeah.
Thank you. Let me ask Kaya and Krista, what percentage of people that you've played for cry?
It almost always happens.
If it's the right music, I would say 95%.
I've watched a lot of musicians do this almost all the time. It's not because they play sappy tunes either. It's because for just a second, that's your moment. I like to read to people. It's one of the things I do. People in acute care, I read, what would you like to hear? Oh, here's my favorite short story. I like science fiction, whatever it is. And we have a little library on an iPad, and then just read it to them. 100% of the people I've read to fall asleep. Every single one. It took a while before a nurse explained to me, no, that's a good thing. No, this is what we want. Right? Other questions? Yes, please.
There's a lot of talking about money in healthcare. We don't have enough money to care for everyone. How does this fit in that discussion?
How do you mean?
Well, it costs money to have people work in healthcare, but I think on the other side, people want to see what does it deliver in terms of cost reduction or so.
We hope that arts and health replaces certain types of care, but it's more likely that it's preventive, that it keeps people, well, we know that if you're in acute care, it's likely to help you get out sooner and take less medication. Lots of evidence to show that. Can't guarantee it, but there's a lot of that. For people in acute care, it's a kind of engagement that keeps people, it keeps people focused on what's well in them, and they just tend to be better. If you're working in the community with people with dementia, for example, it's a way of preventing, it's a way of creating a kind of community of people who are well together. It really works well in communities. And people with dementia and their families, for example. It creates a kind of supportive community that just tends to keep people better, right? Like that. So the idea is that as healthcare changes, hopefully, people see that, oh, they don't actually cost very much. We don't cost that much. But the effect is powerful. We depend on doctors and nurses to go, we see that this works. We don't need the results, just bring them in because it calms people down, it makes people relax, it makes people want to be well, makes them want to eat, makes them want to sleep. That's what we want. And so the hospital or an outside funder, someone goes, you know, we'll fund it. We're about helping develop sustainable programs. That's what Arts and Health Netherlands is about. So not just these guys having a place to work, but also that there's funding and people who can manage these programs who know what they're doing. Then hopefully the funding can happen that way. Does that get? Yeah. Last question.
This is the funding in hospitals, but how does the funding work in the community, preventive?
Kirsten, do you want to talk about that at all? Yeah. Project Director, Kirsten Krant.
Hello everybody, my name is Kirsten. I'm the Program Director. Well, what we're trying to do is that we're actually in the process of writing a white paper to put this more, let's say, on the map in the Netherlands. That's why we also call it Arts and Health Netherlands, because we're too small, this country, right? To really, even though we focus on the north with our programs, we want to make a shift in the Netherlands about this. So we're talking to VWS, the ministries, OCW. They're interested in seeing how they collaborate, because they don't want to go for these programs in the community to knock on the doors of the art funds, right? Because there's already enough people knocking on doors for the art funds. But in a way, there should be also money for this collaborative thing. So domeinoverstijgende collaborations, also funding. And there is actually OCW and VWS are interested. They see that this whole sort of boxing of things doesn't work. And we need also funds that actually are domeinoverstijgend as well. So we're hoping for that in the future, of course. For now, luckily, we got some funding from Nationaal Programma Groningen. But yeah, also in the funding world, there needs to be a change of how we can support this type of work, definitely.
Can I ask you guys to just briefly stand up? Let's thank them. And let's thank you. Thank you, guys. Thanks very much. Thank you.